up to a third of young men under the age of 25 have not had sex in a year. A year.
Right. Yeah.
So negatively impactful. And to see that many people not having sex is very alarming to me, because I think it's just the tip of the iceberg. The way we're trained in medical school and in residencies is that testosterone's not a big deal, and not until men are profoundly deficient, like levels under 300, should we treat them. And so you'll see all these men who are tired, gaining weight, can't remember, depressed, or moody or short-tempered, loss of sex drive. People think about testosterone and they think bodybuilding and sex.
Yo, what up, guys? Welcome back to the show. Today we have on Dr. Wendy Askew. Doctor, thanks for taking the time to be on the show.
Thanks so much for having me, Juan. It's a pleasure. Like I said, I love your feed, and I'm happy to join. And thank you. Appreciate you having me on.
Thanks. Yeah, Dalton was like, you know what, you have to get her on. You're starting podcasting again, and I know my favorite news channel in Texas, KSAT 12, had you on. None other than KSAT 12, so I knew I had to have you on.
Well, I love Dalton, and we love KSAT, and we've done a lot of like segments trying to educate the San Antonio population about some of the health issues that they may be experiencing. So it's always fun to kind of get the word out.
Right, of course. So why don't we get into it? Why don't you tell the people about what you do, your expertise, all of that?
Thank you. So Dr. Wendy Askew, and my original training is I'm board certified in OBGYN, but about 13 years ago, I've been a physician for 25 years. I began to be kind of disenchanted with conventional medicine and seeing so many patients who are on tons of prescriptions and really weren't doing well. They still felt bad. And so I became board certified in functional medicine, and really kind of have gone down this rabbit hole of finding the root causes of problems, looking at issues that might be benefited by supplements, by plant medicines, by hormones, by sometimes taking people off of prescriptions, and by wellness in general. So, meditation, stress management, better diets. And then my niche areas right now are hormones and sexual wellness for both men and women. And then I'm one of Texas's cannabis medicine prescribers. So I love what cannabis medicine offers patients therapeutically. Texas is way behind the times compared to Vegas, Nevada, and other states.
Yeah.
It's a slow crawl, but we're making progress.
No, love it. And you mentioned, you were sort of, dissatisfied, disappointed with what you were seeing out there, as far as people getting the proper treatment. Why don't you talk a little bit more about that? What are some of the biggest things, you saw in your career, the treatment that people are getting? Are they getting bad advice, bad prescriptions? What first comes to mind regarding
Absolutely.
that?
So I always kind of preface my comments with all of the things that I'm doing have a lot of science behind them. But I'll put my little tinfoil hat on and tell you that medicine is about the money, like anything else is. And whether intentionally or not, doctors have kind of become just like robotic thinkers. Someone says a symptom and I start writing a prescription or telling them they need a surgery, rather than like listening to them, taking a more thorough history, doing an exam, and trying to figure out like what's going on in your life that maybe caused you to start feeling anxious or have no sex drive or not be able to sleep at night, rather than just reaching for some Ambien or some Lexapro or something else. And, come to find out, for a lot of people, sometimes talking through it, most of what I do is hormones. So I'm always open to checking people's hormone levels and then talking to them about what hormones can do and what I don't think they can do. And then experimenting. I don't like to use that word. It's just trial and error. With maybe a hormone treatment instead of a prescription. And if we make good progress, then, we're on the right track and we can kind of continue it. So I just saw too many of my colleagues, and I still do feel like 1 million prescriptions for everybody is a great end game if you're a pharmaceutical company. But if you're a patient who really wants to feel better and be healthier, that's really not the best way to achieve real wellness. So I just try to be more open-minded, take other things into consideration, and not just immediately start writing prescriptions for every symptom.
There you go, folks. We have it from the doctor herself.
Yeah.
Regarding hormones, I know we have Michael Sartain in Vegas. He's a big event thrower. He coaches men, and one of the things that he talks about is TRT. And one of the things that he said is it's almost, you know, criminal what some of these men are going through when they're, you know, going to a doctor and he's telling them that he's checking their T levels and telling them that they don't need TRT. I don't know if you dealt with seeing anything like that. I know you help women with HRT. Do you have any experience in the TRT space?
Absolutely. So I absolutely believe in testosterone replacement therapy, and I actually treat a lot of men. So when I began doing more hormones,
Okay.
I treat them. And what your friend or colleague in Nevada sees is the same in Texas. The way we're trained in medical school and in residencies is that testosterone is not a big deal, and not until men are profoundly deficient, like levels under 300, should we treat them. But what you'll learn in the functional medicine space is that what's optimal is usually a range between 700, 1200, sometimes more. And so you'll see all these men who are tired, gaining weight, can't remember, depressed, or moody or short-tempered, loss of sex drive. People think about testosterone and they think bodybuilding and sex, but some of its strongest benefits are for mood and for memory. And so when I see levels that are outside of the optimal range, I always discuss it and get more history, find out if it's a safe intervention for patients, and love to try testosterone therapy, because a lot of times you can get relief from multiple symptoms that don't seem interrelated. But if you understand how testosterone works in the different organ systems, it can help my memory, my mood, my sex drive, my muscle tone, tons of things.
Yeah. So, you know, this guy, he's about 45 years old, and he mentioned he was feeling like he was 19 again. And one of the things, you know, besides, you know, working out and sex, right? One of the things he did bring up was actual working on his business and just being sharper.
Yeah, we don't know until we try it. So if the levels are low and we supplement patients and the levels get into the optimal ranges and they feel better, again, control the side effects if they have any. And it's really a way that not only helps people feel better, but it promotes healthful aging. So we know that it slows the onset and decline of cognitive dysfunction and dementias, including Alzheimer's. It's protective of the heart, protective of the bones. They're even looking at testosterone as a possible treatment for congestive heart failure. And it makes sense, right? The heart's made of muscle cells. And if muscle cells thrive under optimal testosterone levels, then it would only make sense that the heart would be stronger too. That's not completely approved, but it's being investigated, and it shows a lot of promise.
Interesting. And as far as HRT for the women out there, what, you know, can you tell us a little bit more about that?
For sure. Testosterone for women is a good thing also. And most doctors are going to rely on the reference ranges that the lab has established, which aren't really based on optimal levels. So I'll use my own example. So the same thing, like when I went through menopause, my doctors told me the same thing. I was depressed. I was tired because I had kids and a job, and I was in my 40s. And that's just how I felt. And they put me on an antidepressant and Ambien and Xanax. And I still felt pretty crappy. And then this was about 14 years ago, and I started learning about hormones, got on therapy, and lo and behold, I slept through the night. I had more motivation. My kids stopped whispering about how I was getting dementia when I was 42. I felt, I would say I felt 19, but I definitely felt like in my 30s and much better. And when I come off of it to see if I feel normal without it, invariably, I lose my motivation. I'm happy to sit around and watch Netflix or Prime all day long and not do anything. So for me, mood, energy, sleep, mental health, skin health, everything is better when I keep the testosterone levels at levels where a lot of doctors would go, oh, that's too high. It's not actually too high. We know what are the safe thresholds and what are the thresholds where we would begin to cause transitioning effects. Because I have transgender patients that I manage, and we know the level for women that can cause permanent irreversible changes. And so only in patients who that's their outcome would I treat to that level. So there's a lot of art and a lot of science to it, but it can be really impactful.
Interesting. So what are some of the other things that come to mind when we talk about, for you, when we talk about regenerative. Oh, I can't pronounce that word. Regenerative health.
Regenerative.
Regenerative health.
Too many syllables.
Right.
Regenerative medicine is one of my areas of passion too, and this involves a lot of different things, from supplements to stem cells to interventions that help wake up our body's own repair mechanisms. So PRP, exosomes, stem cell treatments, all wonderful therapeutics for patients who are suffering from conditions like osteoarthritis, because all we would prescribe for those patients or do to treat them are things that decrease inflammation, like ibuprofen, Advil, pain medications, whereas a PRP injection in appropriately selected patients, or a stem cell application, or an exosome treatment, or a hyperbaric oxygen treatment, there's lots of regenerative therapies, can actually wake up our own stem cells and stimulate them to start doing repair work and building more cartilage, making new collagen, helping grow new hair cells, doing a lot of beneficial things. So I think that's obviously one of the directions medicine is going, but the FDA controls things, and the pharmaceutical companies fund the FDA. So a lot of times those things will get kind of like a bad rap, but it's often because they're waiting for the FDA to approve one of the pharma companies that's still working on the development of the product. Unfortunately, that's true. But those therapeutics are out there, and they can be really incredible for patients. Prevent surgeries, prevent side effects. Yeah.
No, that does seem incredible. And, speaking of the FDA and, where things are going, where do you see things going in the next 10 years? Is there a good outlook there, or is there still a lot of red tape?
There's still a ton of red tape, and it costs a lot of money for pharmaceutical companies to bring new products and new interventions to the marketplace. But the FDA is absolutely embracing a lot of these regenerative therapies because they're so beneficial, because we're an aging population, and they want, they don't want all of us to be in nursing homes and then walkers and all of those things.
Right.
So whatever we can do to help people maintain their functional status and their mobility and remain active is going to be a great thing when we're an aging society. So and hopefully they'll approve more. Sorry.
And, just so the audience knows, right, what are some of the things as far as stem cells goes that are available like right now, like tomorrow?
Yeah, absolutely. And you'd have to find providers like orthopedic experts who would do bone marrow aspirations and extract some of those stem cells and use those when they're doing it, like say a scope of your knee or your shoulder, whatever joint, and then use the stem cells as part of their surgery or in conjunction with it, or do an injection of the stem cells to stimulate the development of new cartilage, new cushioning, to give relief of pain and improve function, and hopefully defer a replacement of that joint. So a lot of orthopedic docs are doing that. Chemicals called exosomes are kind of like the battery of stem cells. They've got all of the growth factors and cytokines that stimulate repair mechanisms to kick in, but they don't have the genetic material that's located within stem cells from amnion or placenta. And so we think they're going to be safer, but really have a powerful effect on regenerating new cells. And again, like for aesthetics, I love them for obviously reasons. So there's a lot of providers that will offer them for joint health, for skin health. And then if you're looking, it's going to be a little bit more sparse, but for conditions like neurodegenerative things, MS, post-stroke, lots of other applications. But you have to be careful with your providers because there's good players and bad players, like in every other area of the world.
Yeah, so that's actually another one of the things I wanted to ask you about. When people are looking for providers, what are some of the red flags they should be looking for, and some of the green flags as well?
Yeah, I really feel like the red flags are if you get a quick hard sell, and if they are if they don't take the time to counsel patients thoroughly about the data being in, if then they should always tell you that it's still investigational, that outcomes are not guaranteed, that these things are rarely going to be, if ever, going to be covered by your insurance, that it's not just a big money grab, right? So if they're telling you like, oh, a 90% improvement rate and one treatment, things like that. If you feel like you're at the car lot, maybe get some more opinions before you lay out your money.
Right. One treatment, one magic treatment.
Exactly.
Okay. So it should be treatments over time. usually?
Well, it might be multiple treatments depending on the condition that you're getting, but they should just be very honest about what their expected outcomes are. And they should always tell you, like, these things are investigational. They're not FDA approved yet, unless very rare instances. But
Right.
the data show out of Korea, out of other companies that have results. And then it shouldn't be, like you have to take out a loan or a second mortgage on your house to afford these things. And do your own research and get your answers, and then go in with your questions, specifically what the condition that you're looking to treat is. The provider should know what specific condition you're asking about and have some data about that specific condition. There's a lot of chiropractors who are good business people and will offer these treatments. I'm always a little bit leery. I do feel like you should have a higher level of responsibility, ethically, and like medical boards that you are operating under, and you're doing something that's not FDA approved or cleared, but that does have data to support it. So be careful if it's.
I would agree.
Yeah. Yep.
I would agree. And here's just, something that I've heard is that, the chiropractors in that practice, not to put any chiropractors down, but I've just heard science doesn't support what they're doing. I don't know. I'll have to look into it. That's just something I heard very quick on some other type of podcast. But no, like you mentioned, everything you do is backed up with data and science. And so that's one of the big, I'm a big proponent of actually looking at the data, looking at the science, looking at the stats, and then making a decision from there. So no, great to have you on the show. And one of the things you also brought up was, you were also described antidepressants, and about two other episodes on the show, this topic, keeps coming up. Depression, anxiety, taking antidepressants, right? Does that have something to do with your involvement in the cannabis space as well?
100%. Antidepressant medications, in my opinion, and supported by the data, grossly overprescribed. And their efficacy at treating depression and anxiety is a coin toss at best. If you really look at the research, some of the big pharma companies have had up to billion-dollar fines because they buried research specifically showing that adolescents had an increased risk of suicidal attempts and completed suicides. This was like 10 years ago. But, it's a speed bump. You hear about it and then people forget it. So you need to be really careful with those medications. They have a role. Some people benefit. I think they're much more about driving revenue for the companies that make them. So what cannabis medicine and the psychedelics are offering for treatment-resistant depression and anxiety, for OCD, for addictions, is mind-blowing. So I am so excited about the psychedelic space and what's happening within that realm, and the results that patients are getting from treatments with psilocybin and MDMA, plant medicine too. Like, the real psychedelics actually cure a lot of people, where the cannabis is wonderful. It's safe. It helps to improve a symptom, but it's not like I can take edibles for a week and then everything's great. It's something that I need on an ongoing basis. So I love cannabis medicine as an alternative, and I really wanted more alternatives to be able to offer my patients. And so that's what led me to try and learn more about cannabis and plant medicines, and to be able to offer it is important to me.
Wow, it's interesting that you say that. So look at that, guys. Last episode, we had, a naturopathic doctor talk about how she helps people with sobriety and depression with psilocybin and a lot of those, types of natural medicines. And now we have you on the next episode, kind of breaking it down even further. That's amazing.
It's exciting. And it's so good, Juan, that they expected FDA approval for MDMA and psilocybin either this year, although we're getting late in the year. So hopefully early 2024. That's how strong the research studies are for helping patients. So I 100% agree with your guest. It's the way of the future.
Awesome. And as far as Texas goes with medical cannabis, how do you see, the outlook in the next few years? Is there good news, bad news for all my my cannabis network out there?
Well, we had such a disappointing
Um,
session this year.
right,
I'm still super optimistic because I do think federally it's going to be legalized at the federal level. And then I think
right.
what once that comes down, really it's Dan Patrick, even Abbott was like wanting to expand access for patients. And the lieutenant governor, for I don't know what his concerns are, but he just will not move forward with this. So I'm still
Hmm.
optimistic because it's so
Awesome.
safe, it's so beneficial. So yeah, we want very much to grow our program here and help people have access to it. Is it going to help them? I don't know. Do they deserve a chance to try it safely and legally? Absolutely, they do.
Hmm. Interesting. So, another thing I wanted to ask about is, so you deal with a lot of, as you mentioned, you looked at my, you enjoy my Instagram profile, right?
I love it.
I'm up
Yeah,
to all these crazy events in
fun
Vegas.
stuff.
So,
Yeah,
as you might have seen, I'm pretty open, sexually, let's just say,
yeah,
right? I'm pretty open to have the
love it.
conversation. Now, you deal with a lot of subjects that people might, feel embarrassed to talk about, right?
Yeah.
From what you've seen,
Yeah.
what do you feel is the most embarrassing things that people like don't want to talk about that should be talked about more?
I think loss of sexual function as people get older and even in young patients. So on the
Hmm.
aging side, men are so embarrassed about the loss erectile dysfunction and the loss of their sexual capacity. It has so many negative effects on their psyche, depression, introversion, withdrawing from their relationships. So I want everybody to know, some people gross out, but like I want 50, 60, 70-year-olds having active sex lives with their partners, consensual relationships. I want them to be able to maintain it because it has a ton of health benefits.
Hmm.
That's really soft science. On the opposite end of the spectrum, one, I don't know if you've heard these data, but a lot of people and podcasters have been talking about. Chris Williamson and Tom Bilyeu did a great
Hmm.
episode. Up to a third of young men under the age of 25 have not had sex in a year. A year.
Right. Yeah.
So negatively impactful on every aspect of their emotional health, connectivity with relationships and the loss of those things. So I think that's a horrible statistic. I think that
Right.
consenting adults of age should have relationships and that sex should be a healthy part of that relationship. And to see that many people not having sex is very alarming to me because I think it's just the tip of the iceberg of a mental health crisis that we have since the
Yeah.
pandemic, that we have to help these people feel better about themselves, be more plugged in, stop resorting to online sites to meet people and get back out in the world and develop these
Hmm.
relationships and be sexually active because it is very important for our mental health as well as your physical health. I think it's very concerning.
Right. And so, you mentioned young people, going through that or not being as sexually active, right? What do you think is the main cause of that?
I think it's dating sites online, and
Hmm.
unfortunately, social media and what's put out there. There's a lot of studies how the women are going to be drawn to what is in effect like the top 20% of the appearance
Definitely.
in
Yeah.
the post, like your physical appearance. If you're flashing your Rolex on camera, this is not a Rolex, this is a bracelet.
Right.
Um,
Right.
and if you put up the signs and stigma of wealth and success and affluence, women are going to be drawn to that top 20%, and the bottom 80% are going to feel rejected, isolated, and eventually probably
Right.
just withdraw from the game for the search. And then
Right.
they're going to find their sexual outlet in porn or, pretty soon AI robots, just like Japan's got a whole industry of that. And I don't think that's healthy for people. I think we need human
Right.
connection with other people, not just screens. And there's a lot of science to support that. That's not just an opinion. So I think it's
Right.
partly social media, partly the pandemic. So, and a lot of people are still nervous and worried about their health and exposures and stuff like that. But I think it's really important for people to work on building their immune systems, getting back out, re-engaging in life,
Hmm.
and for people to not look so superficially at others. Find your real connection with your real soulmate. That's going to, of course, involve what they look like, but it's also going to involve who they are at their core. And so I
Right.
don't want people, falling into that space.
That's an interesting topic too. Not only the Instagram part, like looking at other people that have it going on while you don't, but also, dating sites. Like you mentioned, a lot of the women are just choosing
Yep.
one moment. A lot of the women are just choosing the best men out there, and then men are choosing whoever from what I've seen. Now, me personally, I don't like dating sites because it
Yeah.
doesn't give me a chance to, display my personality.
Yeah.
And I just really enjoy, talking to people in real life. And I think a lot of people would be surprised that I'm actually an introvert, but yeah,
I'm surprised.
right.
Yeah.
Right. Yeah, a lot of people would be surprised. But like I mentioned before we got on camera, you were talking about my Instagram, right? That's
Hmm.
really a personal brand. And like,
Yeah.
there's another side to me that likes accounting and like just really quiet, nerdy stuff, right? But
Yeah.
as far as my social life,
Yeah.
networking with both men and women,
Yes.
right? There has to be a point where you have to talk to people. So, you know, you could be an introvert, but still
Yes.
there's a social thing that you have to do. So that's
And
definitely
that's the core, right? Like the persona online doesn't necessarily reflect the actuality. And I agree with you because I think chemistry is critical. And I can't get chemistry from a
mhm.
screen or a bio or
Yeah.
even a couple of video clips. That's just something like electromagnetically that people put out that
Mhm.
I need to be in your presence and talk to you and get a sense of. So I agree. It doesn't work for me. And I want people to get back out there and start interacting.
Yeah, and it's also, people talk about the metaverse and one
Yeah.
day everyone will be in VR and screens. I don't think everyone will be in VR and screens. I think a good portion of society will, but it's not healthy. So, society is going to see the effects from that and then pull back. That's just my, kind of prediction on how that's going to play out. But
I agree
do,
with you
mhm.
100%. And I hope you're right.
Yeah, I think so.
It's just always, we all know social media and dating sites, it's not reality. People are lying about what they look like, what they make, what they
Mhm.
wear, what they like to do. And that's unfortunate because, everybody has their own special qualities that make them magnetic to the right people. And you're not going to find those right people if you're projecting something false out there.
Right. Love it. And as far as your expertise and the things that you've seen, or when people are maybe looking you up online, or maybe they're watching this interview, right? What are yeah, maybe they're watching this interview right
Hopefully they
now.
are. Yeah.
What are some of the common misconceptions that people have about what you do?
Wow. It's hard to say. I don't know if they have a lot of misperceptions. I mean, I try to help people,
Misconception.
and I hope that I just try to be open-minded and listen to people, and I try to explore other areas. And if I can offer them help, I will. And usually, if I can't, then I'll know which direction to point them in. So
Right.
yeah, I don't know. Hopefully there's not a lot of misperceptions. I'm a pretty open book. Like what you see is what you get. I swear too
Mhm.
much. I can be an introvert also. Um, but yeah, what you see is mostly what you get.
Right, love it. And then, regarding your expertise, you mentioned we talked about some of the future on this podcast here, right? But what are you most excited about, absolutely obsessed with right now going forward?
In the healthcare space,
Yes.
I'm most excited about the psychedelics. So I'm glad you brought it up because I think you brought it up, what
Hmm.
the outcomes are. And we have this epidemic, a mental health crisis with depression and anxiety. And a lot of people don't realize that that's what they're experiencing, or that there is more to offer them than just, five antidepressants and that don't really make you feel well and have a ton of side effects, so that there really is hope. But I'm also excited
Hmm.
about if people would learn to exercise and spend more time outdoors in the sun, eat a little bit
Hmm.
healthier, meditate. Those things seem silly, but they've got great science behind them. They're easy, they're actionable, they're free in most cases. And if you invest a little bit of time, you can really have profound life improving impact on your mental health, depression, on your sleep quality, on your blood pressure, on chronic pain. So don't discount the seemingly simple, old school things. The new things are great, but the old school things like meditation and grounding and other things that people would consider fringe have got really fascinating science, and they're accessible to everyone.
Right, exactly. And I heard a lot of people saying that as well during the pandemic, right? Like, no, do get outside, exercise, like make sure your immune system is really ready to battle what may come
COVID
your
or
way,
whatever
right?
you bump into.
Yeah,
Yeah.
exactly. Okay, so before I let you go off to the rest of the week, Wendy, do you have just any general advice for anyone out there watching? What's top of mind for you? What do you want to leave the people with?
Yeah, there's good doctors and bad doctors and therapists in any industry. If you go see a provider with a symptom that you're experiencing and you don't have a good feeling about the answers that they give you, or they don't offer you information or sites to look at to get more information, get another opinion. And I mean that for any of your physicians that you see. If you're seeing a therapist and you're not really connecting with them, don't be afraid to fire them or to move on and find another person, because it really takes a little while to find the person who speaks to you in the voice that you can hear and offers you the hope and help that you may need. So just because one doctor said something that you don't like, we're not all, heartless automatons. And if people don't like me, by all means, get another opinion. I want people to find help that works for them.
Right. Love it. Well, thanks for taking the time on to come on the show, Wendy. Where can the people find you?
Thanks so much for having me. So my podcast is finally going to be getting off the ground. I know we talked about this a year and a
Let's
half
go.
ago.
It is. We talked about this a year ago. Yes,
I know.
let's go.
I was in a
Follow her
state of
podcast.
overwhelm. So my website is still under construction, but drwendyaskew.com. My Instagram is Wendy Askew 2000. My old site got hacked. And Facebook, I'm at Wendy Askew. And then I'll be my channel on YouTube titled working title Sex, Drugs, and Wellness, unless they're going to censor everything. And then I'll be going to be sending out starting to with a newsletter for patients that's going to be hormone focused. So we're going to call it Happy Hormones and Healthy.
Nice. I think your titles will be just fine. I think
I
people will love
so.
it.
I trust your advice on this. So yeah, we're going to keep it.
Awesome. Thank you, Wendy.
Thanks so much, Juan. Take care.